Here with more in our Ask the Doc segment is Dr. Msonthi Levine. And wait, let me put on my surprised face.
Yeah, that's good.
We've never heard that before.
Never. Absolutely not. I mean, no, we talk about it all the time here on this show as well as on Saturday. I have a radio show that I talk to the listeners all the time about that. It's absolutely true. The research is out there. It's very evident. I try to impress my patients with that each time they come to the office in terms of prevention and what they can do actually with just changing their lifestyle. A 60–70% actually reduction in the presence of cardiovascular disease, diabetes, high blood pressure, etc.
Start today.
Start today. All the things that keep me busy, that keep a lot of doctors here locally very busy. Just unfortunately the diseases that are brought on by excess of calories and our sedentary lifestyle. And I know it's difficult out there. I'm not saying it's easy, but we just want to impress with the patients, wake them up, let them smell the coffee, and sense that these diseases are preventable for the most part. You just absolutely have to get on board with eating the right foods, drinking the water, exercising. It makes you feel better, you think better, you sleep better. And as he mentioned, a lot of the pain symptoms go away. You know, we treat a lot of musculoskeletal diseases here in Southeast Texas, arthritis. As the winter approaches, we start to see an increase in that. But unfortunately, when you're overweight, you tend to have more joint pain, back pain. You don't sleep very well because of that. It's a plethora of things, all stemming from just being overweight. Your body is more inflamed. Your risk of cancer goes up. So, I mean, I could talk about this all day long because this is what I do all day long. Obviously, we have to go to some other questions, but that's the thing that we would like to impress upon the viewers is you just have to take small steps because it is difficult and just start eating those right things, drinking the right things, and getting a little exercise in at least 5 days a week. We're not talking about hours upon a day. We're talking about 20–30 minutes of some exercise, get your heart rate up. And I think once patients understand how good they feel and how they don't have to come see me.
It's kind of addictive.
Yeah, their pain level goes down, they get it, and it becomes very easy, absolutely. So we just want to keep talking about it and keep trying to help them get to that point. That's what I try to do each day.
So if somebody is out there and they're saying, okay, where exactly do I start? If you could pick one thing that they should start with first, what would it be? A
lot of times it's just starting with the diet. We drink a lot of sugary beverages. We eat a lot of starches. I probably would start with that first, and then a very close second, or maybe even first, just some routine exercise, push-ups, sit-ups, a brisk walk in their neighborhood. Just starting with that. You don't need a gym membership, some tennis shoes, maybe not even tennis shoes, just shoes.
Park far away and then walk to your entry into work?
Absolutely. If you're smoking, that would probably be the biggest thing, is to not smoke. Leave everything else the same. Just don't smoke or try to get off of the cigarettes. That's a problem in and of itself, very difficult to do. So it just kind of depends, but certainly just those small steps, just getting started is probably the message for most people.
I know we've spent a lot of time, but that is important.
Absolutely.
On to some of our viewers' medical questions. This person says, I have a hernia in my stomach and it's making me sick. I must have it fixed, but the surgeon is the same one who created the hernia. I have stage 4 colon rectal cancer and my immune system is weak. Are there any colon rectal surgeons in Beaumont?
I mean, there are, but for this particular person, they have to get back to the physician that performed the surgery. They're very territorial when it comes to that. Whoever operated on the patient, they normally have to go back to that surgeon for follow-up and any complications. I don't care if it's 20 years. If that surgeon is still alive and practicing, they need to go back to that particular surgeon. That's how it is in the surgical world. Not so the case in medicine, but it is in the surgical world, so I'd probably get back to that surgeon.
All right, and we've got lots of other questions, so we'll get to those in just a minute. Don't go away. Dr. Levine will answer your questions next on Live at 5. First, we're back with Dr. Msonthi Levine. Another question. This person is having a very hard time with their sinus and allergies. They've tried everything, but in your opinion, what's the best sinus and allergy medication?
I mean, I normally try the over-the-counter products first because those are good medicines. They're non-sedating, the Allegras, the Claritins, etc., that you can get from most pharmacies. Sometimes you can add a decongestant like a Claritin D, etc. Just be careful. Don't take it more than 5 or 6 days if you have blood pressure medicines. But Singulair is a good product. That's prescription that sometimes can be added to an antihistamine. There are some prescription antihistamines that work a little bit better. Sizol or XYZL is one of them. Clarinex is another. Again, sometimes your environment, sometimes you can do something in your environment. If you have a lot of carpets, rugs, your air conditioning system's not up to par. Those are some things that you can work on to try and make the air more friendly to you, buying an air purifier, covering your mattress, covering your pillows, getting rid of the smoke, those sorts of things. Sometimes it's difficult. Sometimes the problem's at your work, and that's difficult to fix environment at your work. So certainly also nasal steroids such as Flonase, Nasacort can be tried. So you might need to be on all 3 agents to help control your symptoms, but certainly it can alleviate probably 50 to 60% of the symptoms.
Any of those things, do you need to have them in your system build up over time, like the Allegra?
I mean, I think in a day or 2, if you're using all those medicines, you should see some significant relief with your symptoms.
Okay. Another question. I had a lump just below my kneecap, was going to the doctor today, but woke up yesterday. It was gone. My knee feels a lot better. Good for you. What could it have been, and should I still have it checked out?
No. I mean, I don't know what it could be. You know, we get a lot of lumps and bumps on our body, a lot of aches and pains that go away. That's a good thing. That typically means it's benign, that it's nothing to worry about. Certainly, if the symptoms persist, gets larger, more painful, more symptoms, that's more serious. Obviously, get it checked out, but if it goes away,
good for you.
Yeah, absolutely.
Okay. This person, how long does it take to get over a bypass surgery?
You know, it just kind of depends on the condition of the patient prior to going into surgery. That's a CABG or open heart surgery for those who don't understand. So if you're in good condition, it could take maybe a month. But if you went in and you weren't such a good patient, then you had some complications, it could take a year to get over a surgery like that. So it just kind of depends. But I think on average, we're looking at a month to 6 weeks.
Okay. This person has scar tissue in her abdomen. Her OB specialist told her that she needs to have it removed. She can't find a doctor in this area to do it. The one that her doctor recommended doesn't accept her insurance. What should she do?
A lot of times you can ask the doctor. Sometimes there are some ways that they will accept uninsured patients. Surgery is big and certain complications are a possibility. So you can talk with the surgeon, maybe even looking out of the state, getting on the internet. Those are some possibilities. It depends on the scar tissue. A lot of times we don't like to remove scar tissue unless it's causing a blockage or a problem. So just obviously keep looking.
All right, Dr. Levine, unfortunately, we're out of time. We appreciate you being here. And you